Good morning, everyone. Guys, today I'll be telling you about cranial imaging on cranial nerve imaging on SSFP MR imaging. So what is this SSFP MR imaging? SSFP MR imaging is basically nothing. The full form of it is steady state free precision MR imaging. This SSFP MR imaging is also known as CIS or Fiesta sequence. The basic physics behind this SFP MR imaging I'll tell you in some other slides or in some other video. Now today I'll be telling you about some of the nerves presentation on this SFP MR image and why these SFP MR images are very important for us to see the pathology and the anatomy related to these cranial nerves. In this video I'll be discussing basically about these six nerves. That will be six nerves. Like those six nerves will be the facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, which is the 9th nerve, vagus nerve, which is the 10th nerve, spinal accessory nerve, which is the 11th nerve, and the hypoglossal nerve. I'll be telling you how these nerves will appear on this Fiesta or SSFP or CIS MR imaging sequences. The question arises, why do we need a special sequence for this MR image? We already have a conventional MR imaging, so why do we need that SSFP MR imaging? The reason behind that is because in a normal conventional MR imaging, we know that there is a good soft tissue contrast resolution. You can able to see thick cranial nerves, but what about the cisternal segments of these cranial nerves? The cisternal segments of these cranial nerves are very important for some pathological diagnosis, like trigeminal neuralgia, where you want to see that any artery is abutting or indenting these cranial nerves and causing the symptoms. So for them we need to see these cisternal segment, and for cisternal segment, to see these cisternal segment, we need to visualize the segments, these cisternal segment of these nerves, and see how they are relating to arteries, or is there any pathology in that segment. That's why this SFP sequence came into picture. Then what is the advantage of this SFP segment? The basic importance of this SFP sequence, the basic advantage, first is they provide you a great spatial resolution. Spatial resolution is good because the section is very slow, 0.3 mm to 0.8 mm ka there is a section. It can be an axial section, it can be a sedge section, it can be a coronal section, and even you can get a sagittal oblique section or a coronal oblique section to see the cisternal segment of this MR image. The second, the most important advantage of this is that in the cisternal segment we are able to differentiate these nerves from the CSF, because in the high T2 by T1 ratio tissues like CSF or fat, they will appear bright and these nerves will appear black. So a good contrast is created. That's why we are able to visible these nerves on these sequences. That's why we use SFP MR imaging sequence. But the disadvantage is that you are not able to see here a good resolution between the soft tissues. That's why these SFP sequences, they provide you an aid with the conventional MR sequences. That's why we use conventional MR sequences with these SFP sequences to see the cisternal segment of these nerves. So this is all about that why are we using these SFP sequences, why what are the advantages of these SFP sequences, and what is the disadvantage, and how they are aiding in helping us to diagnose different pathologies. So coming with the first nerve I'll be discussing is the facial nerve and the vestibulocochlear nerves. I'll be discussing those first 6 nerves also, but in some other video. As we are seeing in this picture, this is cerebellum and this is pons. So here's the pons, this is the cerebellum, and we are able to see this is the cerebellopontine system. So the facial nerves and our eighth nerve, that is the vestibulocochlear nerve, it basically arises from the lateral part of the pons on both the sides, and both of these nerves, they are traversing obliquely. As we are seeing in this picture, they are traversing obliquely in this cerebellopontine system, and they are entering into the porus acousticus. What is porus acousticus? Porus acousticus basically an opening of internal auditory canal intracranially. So both of these nerves, they are passing from this cerebellopontine system into the internal auditory canal or the porus acousticus. These black arrowheads and these are the white arrowheads, which are basically showing you the 7th and the 8th cranial nerves, and this white arrow, this is showing you the porus acousticus. So are you able to appreciate these nerves and the contrast between the CSF and the nerves? That's why they are very important. So why do we need to see these facial and vestibulocochlear nerves? We need to see this facial and vestibulocochlear nerves. Suppose we need to do a cochlear implant. So in cochlear implant, to see the visibility of cochlear nerve, that they are present or not, we need to do these SFP-MR imaging sequences. Or if there is any tumor which is abutting or indenting or compressing these nerves, then also we are able to make some diagnosis. So let's further go into some other images. Alright. So this is basically nothing but an axial section SFP sequence MR image, where we are able to see the cerebellum and the pons, and these are pontomedullary system, and on the left side we are able to see this hypointense lesion arising from this cerebellopontine angle into the cerebellopontine system going into the porus acousticus. That's why it's very important that the nerve relation to this masses which are present in the cerebellopontine system. As we know from the earlier slide that 7th and 8th cranial nerves were present, they were arising from the lateral part of this pons and going into the cerebellopontine system and then finally going to the porus acousticus. But due to presence of these masses, which can abut these nerves, even can give a compression to these nerves. That's why it's very important to see the relation of these nerves with the masses, and it's give a clue to the surgeon also that how to plan the surgery or what kind of surgery they should plan for the treatment of the patient. Okay, this is a coronal oblique SSFP MR image sequence. Here this arrowhead is basically depicting the 7th cranial nerve, and the mass is abutting the 7th cranial nerve. As we have seen from the earlier slide, if a mass is abutting or coming in contact with the cranial nerve, it's very important for the surgeon to guide about its surgery and gives a clue that what type of surgery now he should do. Since the nerve, the 7th cranial nerve is involved, that's why it's a contraindication for surgical resection. So the surgeon can now here do a stereotactic radial surgery. That's why these SFP sequences are giving you giving clue to the surgeons as well to decide which type of the surgery they should do. Okay, so we know that from the porus acousticus, two nerves are entering. One is the seventh nerve and the eighth cranial nerve to the internal auditory canal. Seventh cranial nerve and eighth cranial nerve, which is the vestibulocochlear nerve, it has two components. One is the cochlear component and the other is the vestibular component. This vestibular nerve again divided into superior and inferior vestibular nerves. To see this superior and inferior vestibular nerve, suppose if a cochlear modulus you are able to see in the picture, then there will be inferior vestibular nerve and there will be inferior vestibular nerve, and if cochlear modulus is not present, then it will be seventh cranial nerve or the cochlear nerve. Sorry, seventh cranial nerve and superior vestibular nerve, and if modulus is present, then it will be inferior vestibular nerve and cochlear nerve. So this sequence, this is a 4-year-old girl of cochlear nerve aplasia. This is nothing but a coronal oblique SSFP MR imaging sequence. Here we are dividing the picture into anterior, posterior, superior and inferior segment. In the first MR image SSFP sequence, what we are able to see here, we are able to see 4 dots here. One this, one this, one this and this one. They are basically nothing. This is the superior inferior vestibular nerve and these are the facial nerve and this one is the cochlear nerve. But in the second picture, what we are able to see, facial nerve we are able to see. We are able to see the facial nerve, we are able to see superior inferior vestibular nerve, but we are not able to see the cochlear nerve. Since we are not able to see the cochlear nerve and we are planning for cochlear nerve implant, which will be unsuccessful. That's why SSFP sequence imaging prior to the surgery is very important. In this picture also we are seeing that the superior and inferior vestibular nerve, they are not separated properly, which is a normal variant. So till now we discussed about the 7th cranial nerve and 8th cranial nerve. 8th cranial nerve, both the component cochlear nerve and the vestibular nerve. Now we will be discussing about the glossopharyngeal nerve, which is our 9th nerve. So this is basically a coronal oblique SSFP MR image sequence, 0.8 mm thick section. Glossopharyngeal nerve, it arises from lateral part of the medulla and they further go into the cerebellomedullary system. From cerebellomedullary system, as we are seeing in this picture, this F is basically flocculus. Flocculus is a lobe, cerebellar lobe, which is above this cracial, this glossopharyngeal nerve. And while below this glossopharyngeal nerve, there are vagus nerve. So this vagus nerve, this glossopharyngeal nerve is arising from lateral part of the medulla and going into the cerebellomedullary system, above which is flocculus and below which is the vagus nerve. And this glossopharyngeal nerve finally enter into the jugular fossa. In the jugular fossa, below them is the vagus and the spinal accessory nerve, and finally it come out from the jugular fossa through the jugular foramen.
So this is all about the 7th, 8th cranial nerve and 9th cranial nerve. In our next segment or the next video, we will be able to see the 10th cranial nerve, that is the vagus nerve, spinal accessory nerve and hypoglossal nerve. Thank you.